Hi, this is John Walker with LaCod TV, and I wanted to take a moment to talk to you about something a little more serious than cooking, technology, or travel, and that's veterans obtaining health care through the VA. Now, I'm a veteran, I want you to know that, and I use the VA medical services to receive health care. I want to talk about a program that will help veterans to obtain faster health care at times. And what we're talking about here is how to obtain health care from the VA through the VA Choice Program or the Veterans Choice Program. This is my real experience in obtaining health care from the VA and experiencing a orthopedic surgery through the VA system with the VA Choice Program. It's really important that you take the time to listen to the video and then share it with another veteran or their family because you can't expect the VA to always tell veterans about all the programs and the ins and outs of the system. It's important to share helpful information. Also, this video is intended for veterans already enrolled in the system who may be experiencing delays in obtaining health care. Lastly, I want you to know I'm not being paid by anybody, not being paid by the VA or the U.S. government. This is voluntary. The information I received helped me to speed up obtaining my health care, and I just want to know that it can help to share information through means outside the VA like YouTube, Facebook, and other social networks. Avoiding the delays in receiving health. Remember the number 30. With the VA, you may know or maybe you haven't experienced this, but it's not unusual to take more than 30, 60, or even 90 days to receive health care from the VA. Now, Congress has really mandated, or we can at least say it's their goal, that the VA provide veterans health care within 30 days. With so many veterans not receiving timely health care, Congress has funded a program named the Veterans Choice Program. Here's how the Veterans Choice Program works. As normal, you will contact the VA for an appointment. And we're talking about the appointments you usually get when you're referred to a specialist by your primary care provider. Second, if the VA cannot give you an appointment within 30 days, you have the option of being referred outside the VA to an outside health provider. Now, don't expect the VA to always inform you about the choice program. You may have to inquire about the program, so ask if you qualify for the choice program. I'll just give you an example. I need an MRI for my knee, and the VA's time would have been close to 90 days before I could receive the MRI through the VA. So when I inquired about the choice program, I was able to get the MRI through a close local outside provider in about 2 weeks. What happens is when you can't receive the appointment within 30 days, the VA's fee-based department sends your information, that's your medical information, to the choice program. The choice program will first you're going to be provided with the phone number for the VA choice program, and you're going to be told to call them in a couple of days. Now, as always, we're not talking about emergencies. If you're having an emergency, you should always go to the closest emergency room. The phone number for the choice program is 1-866-606-8198, and that phone number is also on the VA's website. Now, once the choice program has your paperwork and you called them, what they will do, they will inform you that they're seeking a doctor or practice in your local area who will agree to see you. Now, it might be helpful if you know a local doctor who will see you, who will work with the VA Choice Program, provide them the doctor's contact information. The doctor's office and the Choice Program will provide you your appointment information. Normally, it may take a week, maybe two, to schedule the appointment, and maybe another week for the actual appointment. Why does the Choice Program work? Simply because there are more doctors outside the VA than inside the VA in most areas. I'll give you an example. At the time of my orthopedic surgery, the VA had one orthopedic surgeon who was leaving, and because he was leaving, wouldn't be able to see me through physical therapy and the whole healing process, he recommended to me that I go to the Choice Program. The outside practice I was referred to, and this is just one of many practices, had over 20 orthopedic surgeons. Another qualifying factor may be your distance from a VA facility. If you're more than 40 miles from a VA medical facility, you can also use the Choice Program. Final thoughts on the Veterans Choice Program. Remember, knowledge is power. It's helpful. So share this video with other veterans, their families you may know. You'll be surprised how many veterans and their families do not know about the Choice Program. Ever see an advertisement on TV or the web about the VA Choice Program? Most likely the answer is no. Yet, the government has set aside $2.1 billion for the Choice Program in 2018. Here's the website for the Choice Act, or the Choice Program tells you about it. www.va.gov/OPA/Choice Act. Remember too, it's your right to obtain health care from the VA. The government promised you this benefit when you signed up. It's not a handout, it's your money, it's your right. I want to thank you if you take the time to watch this video. I really even want to thank you more if you take the time to share it with another video. And if you think the information is helpful, save it, give the video a thumbs up, and share it with as many veterans as you know, and share it on your social media accounts. Thank you, John Walker, for Lakat TV.